Hello, thanks for joining us. My name is Jodie Robbins. I'm a registered nurse and the Program Coordinator of Immunisation and Cancer Screening here at WAFA. I have been a registered nurse for 30 plus years, and 17 and a half of those were in general practice. So tonight I'm going to talk about immunisation and cancer screening and what it looks like at WAFA and what the latest things and projects and ideas are coming from. So I'll jump straight into cancer screening programs. So currently Australia has 4 national screening programs. They are breast, run by Breast Screen WA, and breast screening is a 2-yearly mammogram for anyone born with female gender from the age of 40. You're invited into the program at the age of 50 until you're 74, but you can access the program at a younger age of 40 if you wish. You need to be asymptomatic with no lumps or lesions that you're aware of. Bowel screening. So Bowel is run by the Cancer Network of WA, and this program is now for those aged 45 to 74 years of age, and you are sent a kit to your home address from the age of 50, but you can request a kit from the age of 45 to enter the program. Cervical screening commences at the age of 25 for anyone with a cervix, again until the age of 75, and there are now several different ways that you can be screened. A little bit more about that shortly. And then we have lung. So the lung cancer screening program started in July of this year. It's the first new screening program we've had in nearly 20 years, and it has had a rather fast implementation. So the kinks are still being ironed out in the program, but it is definitely going to be a good program for us to have. So a little bit more about the lung cancer screening program. So the Commonwealth Government's National Lung Cancer Screening Program offers low-dose computed tomography, or a CT, scan to people aged 50 to 70 who smoke or have a history of smoking and who don't have symptoms of lung or signs of lung cancer. The history of pack year is worked out as 1 pack a day for 1 year. So for the past 30 years, they've basically smoked a pack a day. The importance of the program can be described as follows. So by the time patients present with symptoms, lung cancer is often diagnosed at an advanced stage. If it's found early, treatment options are greater and are more likely to be effective. Lung cancer is the 5th most common cancer and the leading cause of cancer death in Australia. It is estimated that there were more than 15,000 new cases and 9,000 deaths from lung cancer in Australia in 2024. For our rural and remote communities that don't have ready access to radiology clinics, from November, a mobile CT scanner will be on a truck, and it will take the CT services directly to eligible patients nationally. Of biggest note is that a great many people will have nodules and incidental findings when the CT scans, and these are things that shouldn't be ignored. So there is guidelines that have been on what will be reported on, have been defined by radiology in conjunction with the radiologists. Practice nurses potentially play a huge role in the rollout of the program, dependent on where you work. Using a data extraction tool such as Primary Sense and a data cleanse, the nurses will be able to find the eligible patients and commence the process of active screening. Education on the program and its benefits and the potential risks can also lay with the nurse. Explanation on the potential findings and the need for reassessment should be spoken about before the first screen, due to the large number of nodules that are expected to be found. So with cervical screening, this is the most up-to-date data that we have regarding cervical screening. There are now 3 types of screening available to your patients. There's clinician-collected, self-collected, and clinician-collected using self-collection method. It is the only screening that is still done in practice. And as you can see from the stats available, there's a high introduction rate and then a huge drop-off. And we need to turn these stats around and are hoping that the self-collection is going to do this. We are in danger of falling off the pathway whereby we were going to be the first country to eliminate cervical cancer by 2035. Lower rates of the uptake of the HPV vaccine potentially means that we will need to push this date out. We should be aiming for a 90% vaccination uptake of the HPV vaccine. Screening will still need to happen, even if you've had your vaccine, and that's something that's important that we need to let our people know about. Okay, so the alternate access model for bowel screening is something that came into practice about 18 months ago now. The eligibility having been lowered to 45, and now you can now include this question in your 45 to 49-year-old health assessment, and your clinic can now access kits to keep on site for the program. So this way you can identify an eligible person, you can register the kit with the NCSR, you can educate your patient and hand them the kit to take home with them. We know that people are more likely to commence doing bowel screening under the guise of having had that advice from a registered health provider. So you need access to the NCSR portal on HPOS to order the kits. The kits can be ordered in packs of 10, and once you have them, you must note that there is a 7-month window before expiry, so don't overorder. Once you've registered the kit and printed out the participation form for the patient, they can go home, they can take it home and do what they would normally do with the kit and post it back in the mail. The National Cancer Screening Register, or NCSR, supports bowel and cervical screening programs by inviting and reminding eligible people to screen. Its supports for the lung is slightly different, whereby it doesn't invite eligible people, rather it supports you to register them and then will remind people. It also creates a safety net by prompting participants and their healthcare providers to take the next steps on their screening journey. Integrating with the NCSR supports personalised healthcare, empowering providers to proactively manage and promote participation in Australia's bowel screening and cervical screening programs. The integration allows healthcare providers to access and submit a comprehensive screening information for bowel, cervical and lung directly from the practice management software that they use daily. So as you can see here on the screen, we have all the different forms or some of the different forms that you can actually get through best practice. These are the same forms that you can get through Medical Director and also Communicare. So on to the National Immunisation Program. On screen now you have the headings of the WA schedules that we follow, so the West Australian Immunisation Schedule and the Western Australian Aboriginal Immunisation Schedule. So the new vaccines that have been added to the program this year have been the Abrysvo for pregnant women, used in conjunction with Beyfortus or Nirsevimab for babies. In July, Varivax was removed from the National Immunisation Program and replaced with Varilix. And I've just been informed that our stock in the state has now been depleted, so you won't be able to order the Varivax anymore. Additionally, Prevnar 13 is being removed from the National Immunisation Program and being replaced by Prevnar 20. This is happening in September in a staged rollout. So again, you'll be able to order the Prevnar 13 for certain cohorts, i.e. adults. The Prevnar 20 will roll out more complexly, and the changes are being made gradually in regards to removing Prevnar Pneumovax 23 and replacing it with Prevnar 20, and that'll be over time. The immunisation schedule used to change twice yearly in around June and November. It now changes more frequently with new vaccines being approved. I'd suggest that you make it a point of regularly checking online for changes, and if you read about a change, know that it will trigger a change in the schedule. So you can use the Florence app to record your CPD points, reading articles and watching webinars. And I've mentioned this because in Practice Connect, which is our fortnightly newsletter, there have been in the last 12 months over 208 articles. Each of those is a 5-minute read, which equates to 17 hours. We've promoted 28 different webinars, podcasts, presentations, which is a total of 54 hours. So 71 hours of free CPD points are actually advertised in our Practice Connect newsletter over a 12-month period. The cold chain is everyone's responsibility. It shouldn't rest with just the nurses in the treatment room. From the time of delivery into the practice, yes, at the reception desk, until the vaccine is in the arm, the cold chain must be maintained. So we need to ensure that all of our staff in the clinic, including the doctors, know what to do in the situation of the alarm sounding. Stock control of vaccines is also very important, and making sure that we report all expired and wasted stock to vaccine orders on the appropriate form. And entering our correct batch numbers is also really important. They are used as a tracking tool for adverse events and in the case of revaccination episodes. The cold chain management guidelines have just been released, the WA version, and they will sit alongside this Strive for 5. There is also a cold chain management e-learning module, and I'm just popping that up in the screen there. Cold chain management e-learning module that must be completed by all staff, including admin and doctors, by the 31st of December. So what is a cold chain? What is a breach? So a breach is a temperature. A breach is the temperature of the fridge varying outside of the recommended 2 to 8 degrees. It can go up to 12 degrees for a maximum of 15 minutes before it needs to be actioned. However, if the fridge at any point dips underneath 2, it is immediately classed as a breach and needs to be reported to the local public health unit. Also of note is the light-sensitive breaches. If vaccines are removed from their original packaging and exposed to light, this can and will constitute a breach. So what do I do when I have a breach? So the first thing you need to do in a situation of finding a breach is quarantine the vaccines. By this, you put a sign on the fridge door stating that no one is to have a vaccine until further notice. You then fill in your cold chain breach report form, which can be found online, and send off to the public health unit. And you can also call them to verify the need for a form as well and to ask them any questions. Make sure that you have downloaded your data logger and also make copies of your min-max recording chart. You will be asked for these. I also suggest taking photos as well, just so that the PHU can visually see the breach, especially if the vaccines are not in their original boxes. And when can I use my vaccines again? So basically the public health unit will do an investigation and they will let you know what you need to discard, if any. Please don't use the vaccines until the PHU have given you the go-ahead to do so. Revaccination of affected patients is very real, and it's an issue that every breach is faced with. What we need to remember is that in the past 18 months, more than 500 kids have had to be revaccinated due to cold chain breaches. So this is something that we really need to take seriously. Now, I'm also going to talk to you a little bit about our Clinician Assist website. So Clinician Assist WA launched on the 8th of August 2024 and is a secure website and clinical support tool for GPs practicing in WA, available at no cost. Although it's primarily written for our GPs, Clinician Assist encourages all health professionals providing services to patients, including telehealth, in WA to register and utilise the support of the clinic in their clinical practice. It has replaced Health Pathways WA and provides access to the same trusted local guidance, features and functionality. The site is maintained locally by WAFA and it will continue with continued close collaboration with key stakeholders, including the Department of Health and the Cancer Network of WA. Website content summarises locally relevant assessment, management and referral guidance on key patient presentations, and unlike traditional guidelines, it's succinct and it's easily used during a consultation. Clinical content in the form of pathways is developed by the local GPs employed by WAFA in consultation with local specialists and support the delivery of the right care at the right time in the right place. And just a couple of pathways. So for my benefit, the lung screening pathway. So recently was published in line with the rollout of the National Lung Cancer Screening Program. The pathway provides information for support of underserved communities, conducting assessments and facilitating shared decision-making between the nurse and the patient. This is highlighted through using patient records or opportunistic encounters to identify those aged 50 to 70 with a 30-pack year smoking history who is asymptomatic and either currently or recently within the last 10 years smoked. Taking a detailed smoking history and a family history, using tools like the Smoking History Eligibility Assessment for Aboriginal patients, evaluating suitability for the low-dose CT scan, explaining the benefits and risks and processes of screening, and using resources like the Shared Decision-Making Guide to support informed choices. For cervical screening, the guidance helps practice nurses deliver inclusive, thorough, and patient-centred cervical screening care. The page reminds practitioners to be proactive in supporting patients who are under-screened, never screened, including Aboriginal and Torres Strait Islander people, our cold communities, remote and socially economically disadvantaged LGBTQI plus individuals, survivors of sexual abuse or family violence, people with disabilities, or postmenopausal patients. The page also contains information regarding screening options. Often patients who fit into categories mentioned may ignore their cervical screening reminders, as their understanding is that cervical screening can only be done within a medical centre and with a GP physically carrying out the procedure. This page includes information on at-home cervical screening methods that can alleviate the anxiety and the apprehension. And then for immunisation, we have an immunisation advice request page, which provides contact details and referral options for various services across Perth and regional WA. It also outlines the WA vaccine safety surveillance system for reporting and managing adverse events following immunisation, with an after-hours support via major hospitals. And your vaccine and storage and cold chain breaches, and this page provides comprehensive guidance for health professionals on vaccine storage, cold chain management, and reporting procedures in WA. The page details steps to take during a cold chain breach, including isolating the vaccines, contacting the public health unit, and reporting incidents. It covers vaccine administration errors and the role of WAV's system in reporting adverse events and offering practical advice for transporting vaccines and preventing wastage. Additional resources and contact information for support are provided to ensure safe and compliant handling. So if you're interested in attending a live demonstration, you may want to scan the QR code attached, or there are 2 dates still available for 2025 in September and November. Information on these sessions can be found on the homepage of the Clinician Assist website. If you're unable to attend one of the remaining sessions for the year, please reach out and they can provide you a copy with a pre-recorded demonstration to watch at your convenience. To register for an account for Clinician Assist, please visit clinicianassistwa.org.au and click the Register Now to create your unique login. APRA-registered health professionals will gain immediate access to the site by entering their APRA number on the registration form. All other users will require approval by a Clinician Assist team to ensure that members of the public are not attempting to access the site. If you require support with your registration or logging in, please contact the team by email. For more information, including quick guides on registering and the use of Clinician Assist, or for frequently asked questions on the transition form from Health Pathways, visit wafa.org.au. Thank you.